to demonstrate the new ED admit bed request and how we are using conditional logic to determine whether a patient requires inpatient or observational care. So first we'll go to Add Order. We'll type in a keyword. Admit works fairly well. And we see ED admit bed request or direct admit bed request. We'll choose ED admit bed request. That takes us to the ED admit bed request form, which is a little bit different than the previous one. There's no diagnosis box up top. We'll be using conditional logic to help us with that later on. It does ask for the requesting doc, the accepting doc, and then highlighted in yellow, which is a required form, is destination. We have three choices: acute care, critical care psychiatry, or OR. Acute care will take us through the conditional logic to determine inpatient versus observation. Critical care and psychiatry are always inpatient beds, so we bypass the logic if we click on this, and it just takes us down to their section here where you fill in the diagnosis. If we choose OR, there are some diagnoses, such as appendicitis, that may qualify for observation care, so we'll go through conditional logic for those. However, we're going to demonstrate the observation in conditional logic, so we'll choose acute care. If you notice admission type, we have inpatient or observation. It's not highlighted in yellow, and nor can we change it by clicking on it. This will be chosen for us through observational conditional logic. As we scroll down through the form, the next highlighted in yellow section is service. We'll choose hospitalist, since many of them go to that service, and we'll choose select admitting diagnosis. This brings us to the conditional logic part of the form. There are 10 diagnoses you see listed here that qualify for conditional logic. If your patient doesn't have any of these diagnoses, you can click none of the above and then enter in that diagnosis here in the box below. Once you've done that, you've completed the form, and you can click the circular arrow and head back to the admit bed request. In addition, if your patient is complex and their asthma is only one of the many reasons of why you want to admit them, you would still click none of the above and enter in all the full diagnosis for that patient. However, many of our patients are straightforward diagnoses, and we're going to demonstrate using bronchiolitis on how the conditional logic works. So we've clicked bronchiolitis. If we scroll down this form, and you'll see the diagnosis of the 10 are highlighted here in green, we come down to bronchiolitis. The first box is highlighted in yellow, which means we need to fill it out. It asks for pulse ox on room air. We want to use the lowest level the patient was at during their ED time. So if they came in at less than 89%, we would click that box. If during their ED stay we actually gave them treatment and then they became more hypoxic, which sometimes happens, we still want to use that lowest number. And so if we chose less than 89%, it would just ask us what is the actual number. So say our patient was 87%. At that point, we've completed this portion of the form and we're done. It'll place them in inpatient care, and we can click the circular arrow to take us back to the form. But we're going to demonstrate the observational care logic out of this. So our patient was greater than 91%. They were breathing about 94%. However, they were breathing a little bit fast and not taking PO well. We come down through the form. It says, is the respiratory rate greater than 65 for under a year, or greater than 45 if they're over the year. Our patient was 6 months and breathing 60, so we can say no, they were not. If they were, we'd click yes, and that would put them actually in inpatient care. The next question is, are there any other concerning features that require extensive care? And if we said yes, our patient was apneic, they had a seizure, whatever, you can put that in there. That will complete the form. We'll say that they go into inpatient care, and we've done our conditional logic. But as our many bronchiolitics are, they were just breathing a little bit fast, not taking PO, and we think they need to be watched overnight, and that's perfect for them coming in for observational care. So we've now completed this form. We will click the circular arrow, and that takes us back to the ED bed request here. As you can see now, observation care has been selected for us, and we can go down and complete the rest of the form, such as choosing a team. We'll choose red, selecting their infectious syndrome, which is bronchiolitis, and then choosing their special needs, which is a CR monitor. We'll say